Hi, I'm Dr. Daria.
And I'm Dr. Michael, and welcome to
HealthTalks. So, what are we going to talk about today?
So, we've been having a lot of issues with patients receiving semaglutide and tirzepatide, Wegovy, Mounjaro, from places that don't really have doctors who specialize in weight loss, and some places who don't have doctors or nurses or nurse practitioners at all, and that's been a real problem.
Yeah, that's very, very worrisome.
What are some of the issues there? Well, those medications work great, but they're not working in a vacuum. So you really need to be under the supervision of a physician who specializes in medical weight loss. If you're not, and you're not seeing a registered dietitian, you could actually end up losing more muscle than you actually lose fat. And you've certainly seen some patients with that too.
Which is not a good thing.
Correct. So what is going on? Right now, it's kind of the wild, wild west when it comes to these medications. I do believe there's going to be a period of time where there's going to be a clampdown, but right now, there are places who do hair and nails, and they're handing out the medication.
Which is kind of crazy. I've seen that too. You can order it, it seems like online.
You can order it online. I had a patient who came in, she was getting it out of a basement from somebody's house nearby. So you really don't want to do that for several reasons. Number one, you don't know where the medication is coming from. Two, you don't really know what you're injecting into your body.
Yes.
There are different types of medications. Some are compounded, some actually have the active ingredient. And not to disparage some of the compounding places, but if you're getting a semaglutide salt, it's not really the medication.
Right.
And you really need to avoid that. You want to actually have the active ingredient.
And that could actually be harmful, right?
I think the jury's out on that. We don't really know where those medications are coming from, but it is pretty clear that you really want to have a actual active ingredient semaglutide or tirzepatide rather than some of these salt versions, which aren't necessarily going to work right. The other thing is actually seeing a registered dietitian. Why is that? Well, yes, these medications are going to decrease your appetite, so you're not going to be hungry. The problem is, if you're not hungry, you're not eating.
Right.
And some of these patients that are taking these medications online or somewhere else, they're not eating enough. And what's happening is you're losing more muscle than you are fat. Why? You need to be taking in a certain amount of protein for your body so your body doesn't burn all that muscle. That's where registered dietitian comes in. And that's where a body composition machine comes in. Right. If you're actually going to somebody and they're not putting you onto a body composition machine to find out how much muscle you're losing and how much fat you're losing during a diet, that's a red flag. You should be going somewhere else. All right?
Yeah, you have to learn how to eat while you're doing a diet like this. And sometimes also, if you're starving yourself and you're really not eating much at all, your body's going to slow the metabolism down as well.
100%. So you're actually doing a disservice to your body, and you can actually be hurting your body. The other thing that we've actually noticed is, a lot of doctors, unfortunately, are still prescribing Ozempic for weight loss. That is off-label. It is not designed for weight loss. You can just go on their website. It is a diabetes medication. It's a different dosing, so you really need to be careful about that too. And there have been quite a few problems with that. So I've also heard some patients wondering about some of the long-term complications of the medications. I've had patients ask about gallbladder and things like that. And the honest answer when it comes to something about gallbladder is whenever you lose and gain weight successfully, that's what damages your gallbladder. It's not being on medication for 6 weeks or 8 weeks that's going to damage your gallbladder. Right. It's a weight gain, weight loss yo-yo, that roller coaster that is damaging your gallbladder. And that's why, women in their 40s who are fertile, that's kind of the classic age for having gallbladder dysfunction. Right. So that really has to do with a long-term weight loss, weight gain, not being on medication for just a short period of time. The other question I get a lot about is, well, what happens after I'm off the medication?
Right. I think everybody thinks, oh my gosh, I'm going to gain all this weight back.
Correct. And the answer is, you can if you're not on a regular program with a plan going forward, which is why in our program, we actually do some genetic testing to find out what foods you should and should not be eating. Right. And then you sit down at the end of the diet when you've reached your goal and you meet with a registered dietitian who puts you on a diet tailored to your body specifically so you don't put the weight back on.
Right.
Another question I'm getting is what happens at the end of a diet with semaglutide or tirzepatide? Do I stop it cold? Do I taper off? It's a good question. We kind of recommend that you taper off a little bit so you don't actually just go cold turkey. there's no real science right now directing us in either way, but anecdotally I'll tell you that patients do a lot better when they slowly come off of the medication, as opposed to just stopping it completely.
And I think with any kind of diet where you're going to lose weight, like afterwards, if you go back to the old habits,
correct,
you're going to gain the weight back. Like it's not going to keep it off. You have to then be prepared after you're done with the medication and have a plan to dictate how you're going to eat afterwards.
Absolutely.
And that's why being with the program is so important, because you can be led to great advice as to how to eat afterwards.
Absolutely. And so going to a weight loss specialist is not only going to help you lose weight in a safe way, but help you keep it off long term.
Right.
So
That's the whole goal.
Exactly. So if you're looking to lose weight, please don't just go and order a semaglutide or tirzepatide online, and don't go to somebody's basement in the neighborhood. And please don't go to a hairdresser or something like that. I mean, you really need to be seeing a doctor and making sure the medication's real and that you're under supervision. So anyway, we're always here to help you. Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thanks for joining us at
Health Talks. Thank you.